The spinothalamic pathways. Firstly, let's get orientated. On the left, we have a coronal section of the central nervous system. On the right, we have corresponding transverse or axial sections of the spinal cord, the medulla, the pons, midbrain, and internal capsule. The spinothalamic pathway carries pain, temperature, and simple non-discriminative touch. This pathway ascends contralateral to the side of the cord that the primary afferents enter. The pathway is comprised of 3 neurons from the sensory receptor to the somatosensory cortex. As suggested by the name, this pathway runs from the spine up to the thalamus before being transmitted to the primary somatosensory cortex. It is somatotopically organized throughout its course, with fibers from the lower body lying dorsolaterally in the cord and upper body ventromedially. First, we'll look at the lower limbs and lower body. The first order neuron runs from the sensory receptor to laminae 3 and 4 in the dorsal horn. Here it synapses with the second order neuron, which ascends dorsolaterally in the cord after decussating at the ventral white commissure. It terminates in the ventro-posterolateral nucleus of the thalamus. The third order neuron runs from the thalamus to the somatosensory cortex in the postcentral gyrus. Again, sensation here is somatotopically organized, so sensation from the lower body is delivered more medially in the cortex. Next, we'll look at the upper body, which is essentially the same as the lower body, but is carried up to the thalamus more ventromedially within the cord. Again, the first order neuron runs from the sensory receptor to the dorsal horn. Where it synapses with the second order neuron, which crosses at the ventral white commissure and descends up through the cord and brainstem to the thalamus. Here we can see the second order neuron decussating before ascending to the thalamus. In the thalamus, it synapses with the third order neuron, which is relayed to the lateral part of the somatosensory cortex. From the thalamus to the somatosensory cortex, the fibers are carried through the posterior limb of the internal capsule. Now let's recap the spinothalamic tract. For the lower body, the first order neuron runs from the receptor to the dorsal horn. The second order neuron runs from the dorsal horn, decussates, and then ascends dorsolaterally to the thalamus. The third order neuron runs from the thalamus to the medial side of the cortex via the internal capsule. For the upper body, the first order neuron runs from the receptor to the dorsal horn. The second order neuron runs from the dorsal horn, decussates, and then ascends ventromedially to the thalamus. The third order neuron runs from the thalamus to the lateral part of the cortex via the internal capsule. Finally, let's look at lesions of the spinothalamic tract. A lesion in the spinal cord will lead to contralateral loss of pain, temperature, pressure, and crude touch, 1 to 2 segments below the level of the lesion, and ipsilateral loss of these sensations at the level of the lesion. This is because the spinothalamic tract decussates 1 to 2 segments after entering the spinal cord, causing 1 to 2 segments of ipsilateral loss, with the remaining losses contralateral. A lesion in the somatosensory cortex or lateral lemniscus through which the spinothalamic tract descends in the brainstem will lead to contralateral loss of pain, temperature, pressure and crude touch below the level of the lesion. The loss is contralateral because the fibres have decussated within the spinal cord. Remember, the spinothalamic tracts lie anterolateral or ventrolateral within the cord. Therefore, a lesion to the anterior part of the spinal cord will cause loss of the spinothalamic sensations below the level of the lesion, as well as motor loss, as these tracts are also in the anterior part of the spinal cord. This is known as anterior cord syndrome. A lesion of half of the spinal cord, or hemisection, will lead to contralateral loss of spinothalamic sensations 1 to 2 segments below the level of the lesion, and ipsilateral loss of these sensations at the level of the lesion, as explained earlier. There will also be loss of the dorsal column sensations and motor function below the level of the lesion. This is known as Brown-Séquard syndrome.